Good morning, everyone. As Ingrid said, I am Dr. Martha Staley. I'm the director of the School Mental Health Initiative for the New England Mental Health Technology Transfer Center. We are so pleased that you have joined us this morning, and we're very excited about this new initiative that we're beginning, the Take Heart Ambassador Program. Today, we plan to give you an overview of our work in the New England MHTTC and the School Mental Health Initiative particularly, talk to you about our Heart Collective work to strengthen collaborations between school communities and community health providers, and to tell you more about how we are thinking about this Take Heart Ambassador program in order to help you all spread the word about the importance of comprehensive school-based mental health services in our schools. So I'm going to begin our discussion today just telling you a little bit about who we are if you're new to our work and to the work of the MHTTC network, which is a regionally based network funded by SAMHSA across the country. Let's see. So in our School Mental Health Initiative, which is based at the Yale School of Medicine in New Haven, Connecticut, our aims are to develop and disseminate evidence-based resources to enhance school culture, supporting school mental health and compassion, resilience, and recovery within school communities. And our other aim is to prepare the school mental health workforce to extend trauma-skilled practices throughout school communities to benefit the well-being of both the students and the staff at all levels. Our mission is to enhance school culture and prepare professionals in education and mental health to improve and support the mental health and resiliency of school-age children in the New England region particularly. We are very excited that people from regions outside of New England are joining us today. We want to help spread the word. And one of the great things about the MHTTC networks is that we are all working together to help get the word out and to provide resources to those of you in the school mental health workforce in order to support well-being. So if you're not in the New England region and you're interested in knowing more about the MHTTC network and the centers in your region, you can let us know, or you can visit the MHTTC webpage. But you're all welcome, and we're so excited that you're here. Within our MHTTC School Mental Health Initiative, our particular focus is on childhood trauma and the trauma that people experience within school communities and is reflected in the school communities. We serve people in public and private pre-K through grade 12s, again in the New England region, but we do a lot of work with our partners across the country. And we have a particular focus on bringing awareness of childhood trauma, the neurobiology of trauma, and how as educators, as mental health professionals, we can help create cultures that honor and understand trauma and then work together to both reduce the causes and promote resilience. So we do that by focusing on, as I said, the neurobiology of trauma, but also things like the benefits of mindfulness, how to strengthen, value, and increase social emotional competence, accelerate learning, develop a sense of well-being for students and the wider school community. Our goal with this initiative and with our Heart Collective work is to help schools cultivate compassionate school communities that buffer against the negative effects of trauma, build resilience, and provide stress relief and enhanced well-being for school personnel. We know that if you're working in schools, you have seen an increase in trauma and an increase in burnout and exhaustion throughout our workforce. Ingrid is going to talk a little bit more in a few minutes about that and why we feel this work is so critical right now. But we want to first introduce you to our model of compassionate school mental health, because we've developed this model with educators, school mental health clinicians, community health providers, people with lived experience, family members. And this model really provides the foundation of all of the work that we do and is sort of incorporates our core values. And we take a whole youth, whole child, whole community approach, understanding that, you know, children are both a reflection of and their own ambassadors for what happens in schools and what's happening in the larger community. So our model has 4 different quadrants of the things that we think are essential to building compassionate school mental health systems. The first one is preventing and reducing the causes of trauma and mental health conditions. And that includes evaluating systems, advocating for systems change, providing necessary resources in an equitable way, educating and promoting holistic wellness in a preventative framework. We focus on supporting youth, so identifying those youth in need, connecting them with resources, whether formal clinical supports or natural supports, family support, delivering school-wide programming and creating opportunities. We also focus on building resiliency, as I've mentioned a couple of times. So helping kids and school personnel increase their sense of agency and choice, increasing their social emotional learning skill sets, empowering and lifting up the voices of families and students and community members and school personnel. And then we also focus on developing protective factors. So fostering nurturing adults within school communities, building compassionate and equitable environments, and cultivating a sense of community. So it's from this framework that we will begin talking about the other aspects of our program, and particularly what we're doing here in this ambassador program, which we're very, very excited about. Just as a reminder, if you're just joining us, if you could please drop your name and your email address in the chat, that'll help us take attendance and make sure you get your certificates of attendance. Let's see. So I've mentioned creating a compassionate community a couple of times, and I just want to tell you a little bit more about that, because again, this is the goal that we are aiming for, is creating these compassionate communities. So what does that mean? So it means that we want to help schools and districts have a foundational understanding of the neurobiology of trauma and stress. We want to help schools and school personnel understand the benefits of using a mindful approach to transformational leadership. We want to consider how we can collaborate with our community health partners, community agencies, and other members of the community to help create a comprehensive school mental health support system, particularly now, and particularly in light of the fact that our resources are so stretched in so many ways, particularly in the last couple of years. And we want to vision together with all of the community stakeholders, family, students, staff, community-based organizations, to help create this community. So I'm going to ask Ingrid to launch a poll just to get to, we have over 30 people here, so we want to just get a sense of whether you feel your school is prepared to care for the mental health and well-being of all students, staff, and families in your community. And then the second question is, are you prepared to talk about mental health and well-being with students, staff, and stakeholders, regardless of your role within schools, education communities, or community members? Okay, so it looks like so far people are not, the majority of people are not feeling like their school is prepared to care for the mental health and well-being of all students, staff, and families in your community. We're going to dive in a little bit deeper about why that might be the case. There are lots of different reasons for that, as we all know, from being under-resourced and not having the staff, to staff attrition, to being in a school with particularly high needs, or perhaps being in a school like one that has made the news in the last couple of months in Killingly, Connecticut, that has voted to not provide school-based mental health services. So There are a variety of reasons. We're going to talk a little bit more about those reasons because it's important to understand those barriers when we're talking about how to be an ambassador of these concepts. But what's really great is that most of you answered that you feel like you're prepared to talk about mental health and well-being with students, which is just fantastic and really, really heartening. And I think that one thing that the pandemic has done in the last couple of years is to really bring more attention, more awareness to how important this issue is, and how important it is for all of us to not be mental health clinicians, but to be aware, to be educated, to have an idea of how we can advocate within our school districts. So I'm not sure if you could see those results, but we have a couple more questions. And for this one, I'd love to hear from you if you are so inclined, either in the chat or by unmuting your mic. You can raise your hand if you want. But do you feel like you have the resources you need in order to learn more about and share the urgency of comprehensive school-based mental health systems? And then also very important to us is, what questions do you have about building or deepening those relationships to collaborate on school-based mental health? So do you have the resources, and what questions do you have for us about how to begin doing this work, or how to continue this work, or meet challenges? And so Amanda says that she feels like she's finding the resources, don't have them all yet. That's really common. There are so many resources out there. And what we often hear is not, gosh, I can't find any resources, but there are so many, and I'm completely overwhelmed about what to use, when, how to get the most. We know that you're all juggling a lot of things. To dig through resources is also really difficult, but it's really wonderful to hear that you are finding the resources. Oh, then another person in the chat mentions that Bianca says that she went to the MHTTC 8 series workshop on school mental health. We are going to have a link to that series of workshop and the framework that that's based on at the end of the presentation, but we can also maybe drop that in the chat and definitely get that out to you. That's a series that, as Bianca said, is 8 parts. It's based on the National Best Practices Framework for School Mental Health Systems. It was developed by those of us in the MHTTC network in partnership with the University of Maryland group focused on school mental health. And it's really an amazing series. So we have that framework, which is free, downloadable, easy to access, which covers things like building teams, assessing your needs and resources, understanding screening, taking an MTSS approach and looking at the different tiers and how to offer services. But along with that, in that 8-part series, we also have a series of people, experts in the field, both academic experts and practitioners, people who are actually doing the work in schools, talking about how that framework relates to a COVID, post-COVID world and education particularly. So I urge you to check that out. Amanda says she would like to learn to successfully build those relationships and collaborations. That is so critical. As we know, we cannot do this work alone. We can't do it in isolation. It really takes collaborations, drawing on partners, engaging stakeholders, a lot of listening, assessing what resources are already available in your school community. And that's something that we really are focusing on in this ambassador training, is how to build the relationships, how to talk to people, how to advocate. What are the most salient, important points that people need to understand about why this is so critical? Nancy in the chat says that her school values mental health and has numerous avenues to support students, but there's not enough outside provider support. And we hear that so often is everybody is willing, everybody is working hard, but there just is not enough clinical support. And depending on where you're at, there is a lack of resources in urban centers. Like I live in New Haven, there often aren't enough therapists, but also if you're in a rural community or in a community that hasn't identified school mental health or children's mental health as a need, it's really difficult to know that there is a pressing issue and not enough support. And that's something that we talk a lot about, and how you, even if you are not in a school district that is lacking that support, how you can be a force to support student and staff well-being and mental health. Greg, looking for tips on how to get buy-in from school administration, saying that is actually why we began to create this series, is because we were presenting information to people and they were saying, this is great, I'm on board, I get it. My school board is not valuing this or doesn't see this as an issue, or my administrators are attending to something else and don't see school mental health as being their primary responsibility. And as I said before, there are lots of reasons for those things, but that is really the central issue of why we're here. So yes, school has realized it's an issue, but are very hesitant to put into place preventive measures, upstream approaches, and often, whoops, oh, I'm sorry about that. I got wild with the mouse there. Yes, so that the school has realized that it's an issue, but either they're facing pushback from the community, or they are not sure where to begin, or they're dealing with being under-resourced in terms of staff, energy, and time. There are a lot of those issues that, we operate from the perspective that most people in most places and most schools are doing the very best that they can to serve kids and families and to attend to the well-being of students. But it's overwhelming. The need's overwhelming, the amount of resources, and also the lack of resources, the amount of professional development resources, the lack of staff, time, money. So that's what we want to really tackle in this series. These are great questions. Please, if you have a question, okay, so Greg suggested a community-wide thing, not a school staff thing, had a hard time getting partnerships to do it. Yeah, again, that is really a common theme that we're hearing, is that people understand it's important and it's hard to get it off the ground. People are tired, they're overwhelmed. And so our goal is to provide you with concrete tips, talking points, materials, ways to advocate, people to talk to throughout the course of this ambassador training series. Great questions. If you have a question while Ingrid and I are talking, please do raise your hand, put it in the chat. We'll try to get to everybody's questions, because really this training is going to be for you and based on what you need. And so with that, I am going to turn it over to Ingrid to tell us more about the challenges that we're facing.
Thank you so much, Martha. Yes, this has been a great discussion. And admittedly, we face challenges in supporting the mental health and well-being of students. One thing I've been struck by is the number of people who are looking to ensure buy-in. And one of the great things that I've used as a strategy to ensure buy-in is to present the facts. So recent national surveys of young people really show alarming increases in the prevalence of mental health challenges. In 2019, 1 in 3 high school students and half of female students reported persistent feelings of sadness or hopelessness, an overall increase of 40% from 2009. And then next slide, even before the COVID-19 pandemic, the Department of Health and Human Services reported that mental health challenges were the leading cause of disability and poor life outcomes in young people, with up to 1 in 5 children ages 3 to 17 having a mental, emotional, developmental, or behavioral disorder. And then there are issues of stress and burnout among educators. Recently, a Gallup poll reported that the highest level of burnout among all other industries was in education. And according to that poll, 44% of K through 12 employees said that they were always or very often felt burned out at work, including 52% of teachers who reported the same. So in recognizing all of this, there's also an impact of health concerns on families. When a family member is affected, there may be struggles around issues of access, stigma, family norms, cultural considerations, and a range of others related to care, support, and encouragement. So we considered, with these top of mind, we thought, based on feedback from educators, clinicians, behavioral health professionals, we wanted to develop a series to help school staff increase mental health awareness and literacy, increase stakeholder outreach and engagement, and develop advocacy platforms and take concrete steps that support the mental health and well-being of everyone in the school building. And so with that, I'll let Martha introduce our HEART initiative.
Thank you, Ingrid. I know, we are all so familiar with those challenges. And as Ingrid said, it's so important to acknowledge and understand those challenges as the starting place and to be mindful of those challenges. But while it can feel really overwhelming, the need, and as you all described in the chat, like getting buy-in, not knowing where to start, having a hard time getting people to work together, we in 2019, along with SAMHSA, the Substance Abuse and Mental Health Services Administration, and HRSA, the Health Resources and Services Administration, along with our partners in other technology transfer networks in New England, began the HEART Collective, which stands for Healthcare Workers and Educators Addressing and Reducing Trauma. And this collective was really bringing together stakeholders from across the region from all aspects of this work. Medical provider, primary care providers, mental health providers, educators, classroom aides, school administrators, parents, people who were young adults and just leaving the school system, to bring them together and say, what we need is collaboration. How do we begin doing that? And that forms the basis of our work in the HEART Collective, which includes a great website that has a lot of resources about advocacy, information, the evidence base, collaborations, what to look for in collaborations, how to begin collaborations, how to strengthen them. So I really encourage you to go visit our website. I'm going to ask Ingrid if you could, yes, it's in the chat. That's our website. And it's from this HEART Collective that we are launching this ambassador training program based on the idea of collaboration and advocacy and people working together where they might previously not have been able to work together to help reduce trauma for all members of the school community. So that's a lot of background information about who Ingrid and I are, where we're coming from, and why we feel this is really important. And again, if you're just joining us, if you can put your name and email address in the chat, and also if you have any questions or comments that come up as we're telling you about this, please let us know, because really this program is about you and what you need. So I want to tell you about what this Take Heart Ambassador program is all about, given this background information. So this is a training and technical assistance activity. And if you're not familiar with the term technical assistance, it can be kind of confusing. People sometimes think it means we're giving out technology or helping people with technology, but it's really another way of talking about consultation. So training and consultation activities designed to give you the concrete strategies, tools, and resources you need to help spread the word about the importance of comprehensive school-based mental health services, and to give you those resources in order to help your school communities begin and strengthen those programs with the goal of creating school communities that are compassionate and resilient. So we think that it's important within this series to promote well-being and advocate for improved school mental health supports and resources. We are going to help you access evidence-based strategies to initiate conversations, to advocate talking points, how to get stakeholders on board in school and community health settings, and to just overall increase stakeholder involvement and disseminate public health and mental health literacy campaigns and materials. So our goal in this is really to give you the tools so that you don't have to be reinventing the wheel every time you need to talk about this or advocate for this or explain to somebody in your school communities about why this is so important. So this is this Take Heart initiative and ambassador program is focused on equity at all levels and in all ways in terms of race, ethnicity, socioeconomic status, resources, gender, all sorts of ways. Equity focused, we feel that's an important piece of developing and sustaining compassionate communities. We are focused on building trauma responsive systems. And so we have developed 4 ways to engage, and these 4 strategies have been decided on by that Heart Collective team and the feedback that we have been getting in the last 4 years of this work. But we think it's important to get educated and spread the word about how important this is for not only well-being, but for health, overall physical and mental health, how important it is to academic outcomes, to recruiting and retaining school workforce and children's mental health workforce. The second way to engage is to listen to stakeholders. As somebody mentioned in the chat, like, how do you talk to stakeholders? How do you get them involved? How do you help them understand the urgency of this and the concrete ways to help support mental health in ways that aren't going to be overwhelming or even require huge amounts of money and staff time? How do you vision, plan, and monitor? So how do you create a vision for your school district? How do you make plans to develop and sustain comprehensive school mental health and compassionate communities? How do you monitor that once you've begun working on these activities, engaging stakeholders, getting educated? How do you know if what you're doing is making a difference in your school communities? And the 4th is promoting hope. So filling your toolkits with creative strategies, easy, concrete tips and things that your educators and staff can work into their days to help increase their own well-being and satisfaction, to listen to students and support their well-being, and how to respond compassionately. There are both big and small ways to do that. But we're focused on both, but we want to give you the concrete strategies of how to do that. And we know that there are challenges, and we want to hear about those challenges from you. Because as I mentioned earlier, the pandemic has brought to light some of these issues, but those issues have always existed. We just have a new awareness of them, and those issues have been increased across many, many sectors of our population, particularly in kids. And these conversations can be difficult to have. It really touches at the nature of schools, what they are, what they do, students, what's important for students, for our youth, how to engage families and what happens within families and how to support them. But really it comes back to that model of comprehensive, compassionate school mental health that takes into consideration all of these aspects in order to really strengthen the whole system. So, in terms of the challenges, we often hear that there's a lack of education and interest, lack of resources, concerns about resource management, family and cultural norms, whether this is appropriate, the stigma that still surrounds so many mental health concerns, and concerns around conflicts in schools, families, communities. And I would also add to that, the discussion of school violence that is so top of mind and in the news and in our national discussions. These are all important things when we're thinking about talking about mental health in schools and promoting systems that cultivate resilience. So I'm going to tell you a little bit about our schedule and how these sessions in this ambassador training are going to work in just a moment. But just a quick overview of what will be included in those sessions. So professional development around compassionate school practices. What does it take to actually create a school? What does that kind of school look like? A school that promotes compassion and resiliency and well-being for all members of the school community. Concrete advocacy, fundraising, communications, and engagement strategies. Ingrid is our director of communications, and if you've had any interaction with her, she's amazing at creating materials that in a succinct, easy, simple way really speak to the needs of school districts and what is sort of at the top of their mind when considering these issues. And that we're also going to include talking points, infographics, other materials that you can use to strengthen your own education about these issues, but also that you can pass on to your colleagues, to the educators in your community schools, to families that you know. We want to provide you with those tools as well. I just want to stop and check into the chat. Amanda says she hopes that we're going to address how to put this into practice instead of just giving steps. Absolutely. That is the main focus of this program, is not just giving steps. And I know exactly what you mean, Amanda. And for a time in the pandemic, that was where we started. What we've heard from our audiences, our colleagues, is great. Compassionate school mental health. What do I do first? What do I say to a school board member? What are the words that I say? What are the facts that they need to know? And so that is really what this is focused on, is not so much the knowledge dissemination, but the practical application of that knowledge within schools. And we're going to use real life practical examples of the challenges that we've seen in talking to educators, the ways that they've overcome those challenges. We're going to invite those people to come and tell you how they did it, and then provide time for you to ask them questions about the challenges that you're facing, and really fine-grained detail. How do I do this? And what do I do this? And where do I send this particular information? And whom do I speak to about this? So those kinds of issues we think are really important. I'm sorry, I'm just looking at Chuck's great comment about the program in Charlotte, North Carolina, about how amazing it was to see this group of boys and girls, these students, come together to provide in trauma responsive meetings, and how they're creating communities. We know kids are so good at this, at understanding what community is, at drawing on their own and each other's resources. And we want to talk about things like peer support. How do you get kids involved and engaged in this? Because one of the great things about our youth is that they know how important this is, and they're already talking about these issues. And we, as the caring, compassionate adults, want to give them the tools to advocate for their own selves, advocate for their mental health and well-being, advocate for their academic success. So I love those stories, and we are always on the lookout for exemplars, communities, and schools that are already doing this in really powerful ways. And so we will definitely look into that program and maybe provide some information about how they did that, because we know that there are people doing this all over the country. And so it's a matter of finding them and sharing that information. So I just want to tell you a little bit about the schedule of events. In December, we're focusing on mental health literacy for students, families, and school staff. It looks like from the poll results, a lot of you are very educated about children's mental health and school-based mental health, which is fabulous. I mean, that's great. We're starting at a point where people already are familiar with these concepts. But we know, again, we can't do it by ourselves. We need people in the lunchroom, bus drivers, school leaders, community groups, after school programs to have the basic mental health literacy. That's an understanding of what these issues are, why they are important, what to look for, what to do if you notice a student in distress or if you're feeling distressed. And so that's what we're going to focus on in December. And what we are going to do is hold a session that includes just an overview of the topic, some people talking about their experience with this and how they've been able to implement those strategies, an overview of concrete skills and actions to take, that fine grain detail that Amanda Jo was mentioning in the chat. And then we're going to offer more time for you all to ask questions of the experts being the people who have actually done the work in their schools, stakeholders at various levels. We want to give you time to ask questions, pose the challenges that you're having, figure out what information you need to take away with to feel confident about mental health literacy in your school district. So that's what we're focusing on in December. In January, we're talking about activating your own power, how to operationalize stakeholder engagement. That's how to advocate, what to say, to whom, identifying those other members in your community who can help you do this work, asking for what you want, being armed with the knowledge, the information, the steps, the strategies that schools can use. And again, after each of these sessions, we'll also have a question and answer consultation session. In February, we are focusing on how to vision, plan, and monitor those practices. So how you create a goal for your whatever corner of the school community you're working in, whether it's a classroom, a grade, a school, a district, a state, an organization. How do you create a vision? How do you create plans to make that vision come to life? And how do you monitor for success? And in March, we will be focusing on compassion and action. So advocacy strategies and tips, how to advocate for yourself, how to advocate for educator and school mental health well-being, how to advocate for your students, how to advocate with families, with administrators, with community groups. Yeah. High-level psychomotor skills and clinical skills. Thank you, Chuck. I appreciate that. We're going to be sending out updates to you about when these will be planned, what to look for, what the strategies are. We hope that you will join us for all of these sessions, or one session that really captures your interest. We'll be building each session, but it will also be standalone, and we will have all of the materials and recordings on our webpage. We're happy to send them out to you. We want to hear your questions. We want to hear your comments. And we're also going to be offering continuing education credits for these sessions. And again, more opportunities to engage and request consultation and to learn more about specific resources if you're working on a particular problem. We also want to provide an opportunity for you to connect with colleagues in different areas. I mean, just even in the chats, you can see people saying, oh, I know about this great program in North Carolina. You know, we know that you all can identify things that are not working, and you also probably have an idea of what does work, things that you've tried that you would love to share. And I promise you, if you have a question about it, another colleague also has the same question. If you have a resource to share, somebody in this group will be really grateful to have that resource. And so we want to build that community with you. And as we go on in the series, also offer you a chance to hear about how in the past we have offered stipends to people who are doing this work in school communities, to give them money to buy things like extra materials, to furnish a quiet room for mindfulness and resetting for students and staff, those kinds of things. So we also, in that, want to hear your ideas about how you would like to implement some of these practices, how you could make that happen, and how we might be able to help you with a small financial gift to help you do that through grants. Now, that is the end of our formal presentation. I am going to stop sharing and see if